partnerships. Really appreciate it. Actually, Ronnie Stewart, the University of Chicago. Great.
Great. Thanks, Ashley.
This, only this. No, this is Duffy? I'm the winner. Yeah.
Good morning, everyone. The Subcommittee on Health now order. Before we begin an agreement between the majority and the minority, I'd like to ask for unanimous consent for the House members who are with us today, who are not members of the committee, that they be recognized for 3 minutes to ask questions after committee members have asked theirs. And note, only committee members will be allowed to make opening statements. No objections, so ordered. The chair now recognizes herself for 5 minutes for an opening statement. First of all, thank you, everyone, for being here this morning. It's an honor for those of us that are not from Chicago to be here. I'm Anna Eshu. I have the honor of chairing this subcommittee, and I have many relatives in Chicago. So this is the Midwestern part of my family, and it's an honor to be here with my colleagues on a very serious issue. This is the very first Energy and Commerce Committee hearing on the gun violence epidemic in our country as a public health issue. And this subcommittee has jurisdiction over public health issues in our country. I want to recognize first the members of the committee who represent parts of Chicago and the region, starting with Congressman Bobby Rush, whose district we are in. Thank you, Bobby, very much for inviting us, asking the subcommittee to come here. Congresswoman Robin Kelly, who is here to my left, Congresswoman Jan Schakowsky from the Chicago region, and to Representative Adam Kinzinger, who is also a representative here from the state of Illinois, a little farther away, I think, to Robin. And Mr. Kinzinger makes this hearing a bipartisan hearing, and we're grateful to him for being here today, for his leadership and the leadership of each member that's here today. We're also grateful to have with us, and we welcome our congressional colleagues who are guests of the committee today, Representative Danny Davis, who I always say is the voice of God when I hear that magnificent voice of his, and Chuy Garcia, who is here, the Vice Chair of the Energy and Commerce Committee, Congresswoman Yvette Clarke, and I already mentioned Congresswoman Jan Schakowsky. Now, on this, on the subject matter that's before us today, it's important to note that 100 Americans are killed by a gun and hundreds more are shot and injured every day in our country. Millions of Americans have watched in horror to see the shootings and the massacres that have taken place in our country. They have watched families buried their loved ones, and there are too many that live in fear of what could happen next, and some are here with us today. They're in the audience, they're at the witness table, and they're on the dais as members of Congress. Congressman Rush buried his son as a result of gun violence. I think this collective heartbreak will move us to work with real purpose. We're here to treat American gun violence for what it is, an epidemic. And to treat an epidemic, we have to study it, we have to understand what works to prevent it, and we need to learn how to treat the trauma that's caused by it. We know that a public health approach can work. Consider anti-smoking efforts or preventing injuries, car crashes. We've achieved life-saving results through funding data analysis, encouraging research, and adopting common sense product improvements with these epidemics. Another simple yet profound and proven method is listening to people from the communities most affected by an epidemic and the public health it represents. We're here in Chicago's South Side, where so many have lived with the epidemic of gun violence, and for decades. Thank you again, Congressman Rush, for inviting our committee to hold this hearing in your district and for your years of work to address gun violence. The gun homicide is the leading cause of death African American boys and men ages 15 to 34. And it's the second leading cause of death for Hispanic boys and men ages 15 to 34 as well. African American men make up 52% of all gun homicide victims, despite only being 7% the population of our country. Compared to the rate of gun homicides for white boys and men, same ages, the rate for African Americans is 21 times greater, and the rate for Hispanic men is nearly 4 times greater. Notably, the communities most impacted by gun violence are the most knowledgeable about how to treat it and prevent it. It's why our witnesses include Mr. Spencer Leak Sr., owner of a family-run funeral home in the Chatham neighborhood, who has comforted hundreds, if not thousands, of families whose loved ones have been killed by a gun. It's why we're listening to Pastor Brenda Mitchell and Mr. Norman Kerr, who've taken their experiences with gun violence and used them to promote common sense, evidence-based policies. And it's why we're hearing from the physicians who work every day to heal the physical, mental, and generational trauma from shootings, and who see the bodies that are ravaged by gun violence. Today's hearing will not be enough to stop the daily violence, but we can broaden our understanding of how best to treat this epidemic and provide resources for public health research. I'm proud that the House voted to provide $50 million for gun violence research at the CDC and the NIH, and the Senate needs to do the same. I want to thank Congresswoman Robin Kelly, a leader on the issue of gun violence, and for introducing, yeah, sure, you can applaud. Every member welcomes that. It's a validation of our work. I want to thank her for introducing H.R. 1114. And this is legislation that requires the U.S. Surgeon General to provide an annual report to Congress on the public health impacts and the, you can applaud, and the costs of gun violence in America. And I hope that our hearing today helps that bill come closer to becoming law. So thank you, and Robin Kelly. Again, I thank each of my congressional colleagues. It's a special honor to join with you here today in Chicago. I want to thank each one of our witnesses for your professionalism and your willingness to be here with us today. And everyone else that has joined us, those that are in the audience, thank you for being here today. Collectively, I think your presence and your testimony is going to fuel our action. I now have the privilege of recognizing the gentleman from Illinois, Mr. Rush, for his opening statement.
I want to thank you, Madam Chairman, and my friend from the great state of California. You and I were sworn in together in Congress back in January of 1993, and we have enjoyed each other and had our friendship has flown all the way to this day and including this day. I want to thank you for convening this important hearing and discussion right here in my district at the Kennedy King College. Kennedy King College is in some sense apropos for a discussion on gun violence, in that both the John F. Kennedy and Robert F. Kennedy and Dr. Martin Luther King Jr. was killed by gun violence. Gun violence, Madam Chairman, is indeed a national epidemic. Gun violence undermines the public health and the public safety of all of our communities. This epidemic has had painful consequences for far too many families here in Chicago, including my own family. Far too many families in my districts and similarly situated districts all across the country have felt this painful consequences. Madam Chairman, you mentioned my son, whose name was Huey. Huey's murder was 10 years ago this very month. The anniversary of his murder was October 31st. So we're 10 years later. We're still fighting, still working to try to resolve this matter of this epidemic of gun violence in our nation. Madam Chair, way back in 2017, I started calling for a hearing such as this to take place here in my district. Important conversations are going on in Washington, D.C. But just as important, if not more so, is to be having these conversations right here in a community that for too long has felt the pain of this epidemic. It is for this very reason that I am pleased that we're finally convening today this hearing to discuss this public health crisis, this epidemic of gun violence. And I want to thank all of my colleagues on both sides of the aisle for being here today. And I want to thank the witnesses who come out at their own expense, sacrificing their own time and resources to bear testimony at this hearing. And Madam Chairman, I am confident that through today's hearing, we will be able to shine a light on the public health impacts, of gun violence. And I'm optimistic that we will walk away and conclude this hearing with tangible ideas and solutions that will protect our communities in the future from this widespread and totally unrecognized epidemic. This epidemic. Gun violence is not just a law enforcement issue, Madam Chairman. It's a health care crisis in our nation. And as you stated earlier, it's an epidemic that we must address as an epidemic in our federal government. Madam Chairwoman, I look forward to hearing from today's witnesses. And with that said, I ask for unanimous consent to insert in the record the testimony of an individual who appeared at a hearing that I had in Washington. That was an unofficial hearing, but I had a hearing at the Library of Congress almost 2 years ago, where Dr. Megan Rainey, an emergency physician, a violence prevention leader, and the chief research officer of Affirm Research. And Affirm Research is the country's only non-profit institution dedicated to solving gun violence through the public health approach. And Madam Chairman, I want to submit with unanimous consent her testimony for the record.
So ordered.
And Madam Chairman, with that, I yield back the balance of my time. And again, thank you for your participation and your leadership on this and other issues in our Congress.
The gentleman yields back. Let me just say on behalf of my colleagues, we are all very, very grateful to the faculty, to the entire team here at Kennedy King for your hospitality, for your warm welcome, for the coffee when we came through the door and had this morning. Let me just say that the two words, Kennedy and King, will always be a source of inspiration to each one of us, and how fitting it is that we are having this hearing in an institution of learning. It is now my pleasure to recognize the gentleman from Illinois, Adam Kinsinger, for his 5 minutes and his opening statement.
Well, good morning, everybody. And for our witnesses, thank you very much for being here. Chairwoman Eshu, thank you for making the trip. And to all my colleagues, I really appreciate you all being here. I may be outnumbered today, but I assure you there is a 100% turnout of Republicans from Northern Illinois. So, yeah. One of the other things I want to make very clear, because you don't get to see this a lot when you watch TV and stuff. Most of us here, I think all of us, get along really well. We actually respect each other. Unfortunately, you just see the times we argue and debate, and you assume that it's like that all the time. We actually like each other. And if I don't like somebody, it's not because of their politics. It's maybe because they're a jerk, but nobody here fits that bill. But I think that's important for me, because I want to say this. You know, I think when we get into these debates, whether it's guns or gun violence, a lot of the times both sides just retreat to their corner and mistrust each other in a conversation. And they assume the worst of what folks are saying. And in some cases, people may mean the worst when they make a position. But I think this is, while we're never going to agree at whatever the end result is in the near future, I think there's a lot of areas we can agree. And I think if we can begin to talk to each other again and respect each other again and listen to each other again, I think we'll be able to make some progress. And that's why I'm here. I'm actually here not to debate my points and not to argue. I'm here to listen. I'm here to listen to the people of this community, to learn more about what's working and what more we can do at the federal level to help remedy some of these issues. You know, whether it's a small town or a big city across the nation, Americans are terrified by the mass shootings they've seen that have sadly become a regular occurrence. Too often, though, our attention to gun-related violence focuses more on the mass shootings, and hardly any goes to the steady, devastating strings of violence and daily killings that happen here in Chicago and elsewhere. And frankly, I'm horrified each week when I see the number of people shot or killed over the weekend in Chicago, or when I get a notification on my phone about an active shooter. This is our community, and we need to work together to stop this violence. As a congressman, I feel the heat on all ends of this debate, as all my colleagues do here, and I see the validity of both sides of the conversation. We clearly have a gun violence epidemic here in America, and I want to work with my colleagues on both sides of the aisle to find solutions that will reduce suicides, drug-related violence, gang violence, and mass shootings. While the larger gun debate continues, I believe there are many areas we can find agreement, and it's our duty to do so. And today I look forward to hearing from our distinguished panel of witnesses about what more we can do to address this problem. During this hearing, I'm interested in discussing the community aspect of the gun violence crisis. I believe this component is at the heart of a lot of issues we face. I know there have been community initiatives in Chicago, including job training, youth-based programs, and support groups, which have made a significant impact. These programs, that are often formed by the community and for the community, have shown how critical of a role communities can play in addressing this crisis. We really need to make sure we're paying attention to these programs and replicate them when they're successful. I'm also interested in the mental health aspect of gun violence and what we can do in Congress to ensure we provide the tools necessary to address this component of the problem, such as improving access to community health centers and those needing medical help. But we can't legislate a heart, and that's where community and religious organizations come into play. They can help guide and give people hope for a better future. If you don't have hope, and you don't have any reason to follow a moral code or fear the results of your action, tragedy in many cases follows. Desperation can be a dangerous trigger, and to the extent we can work on helping and healing those who are struggling and in the stigma of discussing and facing mental illness in this country, I fear things may only get worse. In discussing the desperation and hopelessness, we come to the issue of suicide. In 2017, 60% of gun-related deaths were suicides. And here in Illinois, one person dies by suicide every 6 hours. In the age of technology and instant gratification, more and more people are feeling less connected. They feel isolated and hopeless. And it's an issue we need to resolve as a society. Kids today feel that their self-worth depends on the number of likes or comments or snaps they get in a given day. And that's a concern to me. So as we get into these different issues surrounding gun violence, I want to reiterate it's a complex problem that requires comprehensive, holistic approach. I'm grateful to our subcommittee for holding this hearing today, and especially to our panelists for being here to share their experience, their expertise, and insight as we look at the root cause of this violence and work together to find real solutions to address the gun violence epidemic. With that, I yield back.
The gentleman yields back. It's now the chair would like to recognize, excuse me, Mr. Butterfield, the vice chairman of the full committee, for his 5 minutes for an opening statement. Pleasure to recognize you.
Thank you very much, Madam Chair. I know Ms. Clark may not take too kind to that. She is the vice chair of the full committee. I'm vice chair of the subcommittee. And thank you.
You just got a raise.
I know. Thank you. But let me join Congressman Rush and Congressman Kinzinger for join with them in thanking you for your incredible work on this subcommittee. You promised us months ago that you would have this field hearing, and you have fulfilled that commitment. And so we thank you very much. It's good to be with my colleagues, particularly those from Illinois. And I have a good friend, Bobby Rush, who sits to my right, and I understand that we are physically in your congressional district. So thank you for your work. Madam Chair, the gun violence epidemic in America can no longer be ignored. We must treat this epidemic for what it is. It is a public health crisis, and that's why we are here today. Democrats in the House recognize this crisis, and we are determined, yes, we are, we are determined to take some action. With that said, Madam Chair, I would like to yield 2 minutes to my friend from Illinois, Congresswoman Kelly. I was going to yield Congresswoman Kelly sometime if she's not on the schedule to do an opening statement. Yeah, she is on the schedule. Reclaiming my time.
Don't lose the time.
I just didn't want to leave my friend out, Ms. Kelly, because she works so hard. But for too long, Madam Chair, we have handcuffed the federal government from researching the affliction of gun violence in America and its impacts on public health. We need to marshal the resources of the Department of Health and Human Services and the CDC to know the impact, the huge impact that gun violence is having on kids right here in Chicago and our neighbors all across the country. We need to know how they will be impacted throughout their lives after they witness their loved ones get gunned down in the streets or committing suicide with the assistance of a firearm. We need to know why the homicide rate in America is more than 25 times the average of other developed nations. We are going to face the gun violence epidemic head on, and today's hearing will help us in that fight. I now want to yield time to Ms. Schakowsky, since she is on the second tier, but she is nonetheless a very strong and forceful leader in this area. Ms. Schakowsky?
I thank the gentleman for yielding. So we heard that number, an average of 100 people a day. That adds up, if you multiply it by 365, 36,500 people a year dying from guns. In Chicago, as of Sunday, 2,101 people shot and 382 killed. This is a crisis. It demands a sense of urgency right now. We are raising the profile right now today, but we need action. So, in Chicago and in Illinois, we have good laws on guns, but 60% of the guns that come into our state come from other states across the border. You can go to Indiana on a weekend and go to a gun show, open up your trunk and load up that car with any kind of gun that you want and drive across the border. We don't stop people. I want to thank not only our panel, but I see people in the audience with red shirts, Moms Against Gun Violence. Moms, thank you so much. I see people that are here that want to help us. They deserve our help. And on the panel, let me just thank Pastor Mitchell, especially because of the feeling of a mom, not only as an expert now on this, to bring that. And I want to, Mr. Leak, a friend of mine, when we're talking about the number of people killed, I said, think about if it were a virus, what would we be doing? We'd be searching for that. And he said, well, what about if it were war, if it were terrorism? He said, we'd be at war. This is a war that we have to win. Children are hiding in bathtubs in their homes to seek refuge from bullets that may come through. So this is an opportunity and an obligation today to actually move ahead. Thank you. I yield back. I thank the gentleman for yielding to me.
Thank you, Madam Chair. I'll yield back.
Gentleman yield back now. Nice. Gentlewoman from Illinois, Congresswoman Robin Kelly, for her statement, and with thanks for your work as well.
Thank you, Chairwoman Eshoo, and thank you for your leadership in this area. And I want to welcome all of my colleagues to Chicago and thank all of the witnesses for taking their time to be here. But thank you for holding this important hearing on gun violence as a public health crisis. Thank you to all of my colleagues. As I said, really appreciate you being here. By being here, you're showing your commitment to solutions that will end our nation's gun violence epidemic. Congresswoman Schakowsky has talked about the statistics, over 35,000 people and the number of people in the Chicagoland area. Like nationwide statistics, a disproportionate number of these victims are young African-American men. Specific to the public health threat posed by gun violence, I have introduced, as you've heard, H.R. 1114, legislation to require the Surgeon General, our nation's doctor, to submit an annual report on the impacts of gun violence on public health. In 1964, the Surgeon General issued this report, Smoking and Health. That report sparked a revolution in thinking about tobacco use, smoking, and public health. In 2019, it's time for this Surgeon General to issue a report on gun violence. In addressing the public health impacts of gun violence, we cannot be limited to the immediate impacts of bullets on the human body. We know that gun violence takes an emotional and psychological toll on communities. In some parts of my district, young people experience levels of PTSD on par with returning veterans because of regular gun violence. Simply addressing easy access to guns will not solve all the challenges in these communities. Decades of systemic underinvestments and disinvestments in schools, transportation, businesses, and public spaces, coupled with residential segregation by race, has created a divided city. A divided city in which gun violence is largely concentrated in Black and brown communities that are underserved, under-resourced, and for some, weary of law enforcement. As a member of this subcommittee and chair of the Congressional Black Caucus Health Brain Trust, I am dedicated to finding solutions that improve the health of all communities across the country. This includes preventing gun violence. As I said, gun violence impacts our society in various ways, and not only does it take a toll on our healthcare system, it also negatively impacts our economic and reduces worker productivity. A recent study on gun violence found that loss of quality of life, psychological and emotional trauma, decline in property values, and other legal and societal consequences stemming from gun violence costs an estimated $174 billion. Of that cost, the government directly absorbs $12 billion. Instead of using these funds to invest in our communities, workers, and their families, these dollars are bled away due to gun violence and its impact. I always say nothing stops a bullet like an opportunity. In order to combat gun violence and help these communities rebuild, they need investment. This Congress, I've introduced several pieces of legislation to improve economic opportunities in underserved areas, including creating Pathways for Youth Employment Act, Heroes for At-Risk Youth, and Community College to Career Fund Act. For the past several Congresses, I've also introduced the Urban Progress Act that would also help to fill this void in economic opportunities, strengthen police-community relations, and promote common-sense gun violence prevention policies. I look forward to the witnesses' testimony, and again, welcome, and I yield back.
The gentlewoman yields back. The chair reminds members that pursuant to committee rules, all members' written opening statements shall be made part of the record. I now would like to introduce the witnesses for today's hearings. To my left, Pastor Brenda Mitchell. She is the mother of Kenneth D. Mitchell, Jr. Welcome to you, and thank you for being here with us today. Dr. Selwyn Rogers, Jr., Chief, Section for Trauma and Acute Care Surgery, and founding director, the Trauma Center, University of Chicago of Medicine. Welcome to you, and thank you for joining us here today. Dr. Ronald Stewart, Director of Trauma Programs, American College of Surgeons, Committee on Trauma, traveled from Texas to be with us here today. Mr. Norman Kerr, Director of Violence Prevention from the City of Chicago. Thank you for joining us today. Mr. Spencer Leak, Sr., the President and CEO of Leak & Sons Funeral Home. He has a real story to tell. And last but not least, Dr. Neva Lubin-Johnson, immediate past president of the National Medical Association. Thank you to you. Thank you to each witness. We look forward to your testimony. And now at this time, the chair recognizes each witness for 5 minutes. We'll begin with Pastor Brenda Mitchell. I think that you're probably familiar. Do we have the lighting system there? Yeah. Green, you know what green means. Yellow, caution. When the red light comes on, full stop. All right? You're probably wondering why that doesn't apply to members of Congress. But anyway, anyway, thank you again, and the chair is pleased to recognize Pastor Brenda Mitchell for your 5 minutes of testimony.
Thank you. Good morning to this esteemed body, to Everytown Survivor Network for allowing me to be here, to the moms of Mom Demand Action and Purpose Over Pain, who has also given me my voice. I also recognize Spencer Lee Sr.
Excuse me, Pastor. Can you move your microphone much closer
Okay.
so we
Am I
don't
good?
miss a word?
There we go.
There, better.
And I also recognize Spencer Lee Sr., who was the recipient of my son's burial service and give me a voice also on Black Love. I am Pastor Brenda Mitchell. I live in University Park, Illinois. I have lived and worked in the Chicago area most of my life. Today I am here as someone who has experienced 2 family members taken by gun violence, my brother and my son. Today I'm here as a voice for my son. I am here as a voice for my community. I am here on behalf of the hundreds of mothers who have had their children torn from their lives by gun violence. My son Kenneth was the center of our family. He was the first grandchild on both sides of the family and became a role model for his younger siblings and cousins. At the age of 31, he was the single parent of 2 little boys, 8 and 6, and another son who would be born 30 days after his death. It was Super Bowl weekend. As the manager of a golf center in University Park, he was hosting a Super Bowl party on Sunday. His boys were with their mother, so he took the rare opportunity that evening to spend some time with friends at a local sports bar, playing darts and enjoying each other's company. As Kenneth was leaving, an argument broke out between 2 individuals outside of the bar. Kenneth intervened, attempting to defuse the situation and make peace, when a friend of one of the individuals went to his van, grabbed a gun, and started randomly firing into the crowd. Kenneth was struck by a stray bullet and killed. I received a call in the middle of the night that no parent wants to receive. I was told my son Kenneth had been hurt in a shooting and he was lying at the scene with a sheet over him. I could not tell my husband his son, his namesake, our firstborn child, was dead. Earlier that day, I distinctly remember feeling so satisfied with my life, and I thank God for meeting my needs and the needs of my family. I could not ask for anything. Little did I realize that in less than 24 hours, I would have to ask God for strength. After Kenneth's death, I felt for the first time in our lives that my family was dysfunctional. My son was a crime scene. I could not touch him. The pain was so intense that I would not wish this experience on my own worst enemy. Even worse was trying to navigate through it with no resources. I was traumatized with nowhere to go. Just a week before Kenneth's death, our younger son Kevin left for his 3rd tour of duty in Afghanistan. This is the kind of things that a mother worries about. I prayed for Kevin, placed him on the altar, and in my mind, he was the one who was in danger. I never would have imagined Kenneth would be the one to die from an act of gun violence right here at home in a free country. A week later, I brought Kevin back to bury his brother in a free country. My life shows that trauma, post-traumatic stress syndrome, and grief have lasting effect in the lives of those that are touched by gun violence. However, I learned these terms and the impact on health. Even if I didn't know what it was called, I knew how it felt, and I saw the effect it had on my life and the lives of surviving family members. My mother could not handle after losing her son, her first grandson, to gun violence after the death of her own son. My mother willed herself out of her pain. She died from a broken heart. I myself had to leave a successful career because of PTSD and trauma. I lost cognitive memory. I did not know my phone number or the names of people very close to me. I still struggle to recall the date of my son's death. This is not because the date is not significant to me, but it's because it's a manifestation of that trauma. I almost died 3 times with extreme hypertension and narrowing of the arteries in my brain because of the level of stress I was under. I was grieving for my son, raising my grandsons left without their primary parent. I had to look at my youngest grandson and know that he would never meet his father. I had to recreate his father for him. There are no words that communicate the depth of that loss. How many young men and women have we lost who will never have the chance to reach their full potential? Every day there are communities being shattered by the devastation that is this crisis of gun violence. We have the children in Chicago who aren't worried about growing up to be a doctor or a lawyer. They're just worried about growing up, period. That reality is unacceptable. In my own journey, and I'm almost done, I have come full circle. I identify with the devastation families experience every day in our country and in Chicago. It has become my passion to help others understand how trauma of gun violence can affect individuals and communities. I have become an advocate for trauma-informed care, and I will do whatever I can to help others so that they don't have to experience what I've gone through. It's so important that families like mine who have been deeply impacted by gun violence to keep telling their stories. If we keep shining the light on the impact of gun violence, then our children's deaths are no longer in vain. I thank you for allowing me to humbly submit this testimony.
Pastor Mitchell. Pastor Mitchell, thank you for the courage you've exhibited today in coming here to tell your story, which is just riddled with just tremendous grief. Thank you. We really hold you in our debt. I now would like to recognize Dr. Selwyn Rogers Jr. And thank you for being here today to be a witness. You have 5 minutes.
Morning. Thank you very much, Chairwoman Eshu and the entire Subcommittee of Health. I want to thank all of you, including Bobby Rush, for all that you do to continue to keep Chicago and America safe. We're honored to have you here in Chicago and appreciate the time you're spending to understand the devastating toll violence has on the lives of Americans and the steps you and Congress can do to help protect our children, our families, and our country. My name is Selwyn Rogers, and I serve as a professor of surgery and chair of trauma and acute care surgery at the University of Chicago Medicine. In my work, I lead a dedicated staff of specialists who care for people who have been traumatically injured. Given our location on the south side of Chicago, we sit in the epicenter of much of our city's gun violence.
Dr. Rogers, can you move, I think
Right,
for everyone that's going to speak, the most effective ways to get this microphone really close to your lips, all right?
Will do.
We don't want to miss a word. Thank you.
When we think of gun violence in the United States, we often think of tragic events such as mass shootings in Dayton, Ohio, or El Paso, Texas. However, in Chicago, every day we see smaller examples that are no less devastating. We see a 22-year-old man driving with his girlfriend shot and killed in a carjacking. His crime, he owned a nice car. His name was Alexis Andrade. We see a 36-year-old mother of 3 shot and killed in front of her children in a cell phone store. Her name was Candace Dickerson. We see the 11-year-old girl killed by a stray bullet in her living room while she planned her birthday party the next day. Her name was Kentavia Blackfull. At our hospital at the University of Chicago Medicine, we work to the absolute limits of our abilities every day to save people like these. But far too often, the bullets lead to death, despite all of our efforts. When that happens, we have a moment of silence to mourn the loss. However, we know that that moment will soon be pierced by screams of anguish and sometimes anger at a life that has been extinguished way too soon. The loved ones plead to tell us that their daughter, their son, their significant other is not dead. They ask me, how could this happen? Why did this happen? I have no answers, but answers are exactly what we need. I'm here to testify today that we collectively need to find answers to the intentional gun violence that killed over 14,000 Americans in 2017, the data that's most recently available. In addition, as we also noted, over 23,000 Americans were killed by gun suicides that year. In February of this year, I joined a medical summit of more than 40 professional organizations that agreed upon a united statement on the impact bullets have on the health of people. My colleague, Dr. Ron Stewart, to my left, will elaborate on these in his remarks. We must understand this violence is a public health issue and a public health crisis, and as such, we should address it with the same urgency that we do for Ebola or any other disease we know we can treat. Because when we do that, when we look at gun violence as a disease, that means it can be treated and it can be cured. If we make a true, meaningful investment in our communities, we can address some of the holistic issues that have created this gun violence epidemic. Consider, for example, that the unemployment rate in our South Side coverage area is more than 5 times the national average, or that 43% of children of color here live in poverty, more than double the state average, or that Southside residents suffer significantly higher rates of chronic health conditions such as asthma, diabetes, breast cancer, and HIV. In this unhealthy environment, where day-to-day life is a constant struggle, where homelessness and hopelessness are all too common, is it any wonder that there's such a high rate of gun violence? To address this, we need to develop evidence-based solutions and invest in research to address these root issues. Federal, state, and city dollars need to be dedicated to the study of improved prevention efforts. Beyond that, we have to invest in remedying the social factors such as educational disparities and lack of economic opportunities that are often at the root base of gun violence. While these measures will take years to enact and take effect, there are a number of programs that can be invested in now. Violence interruption programs such as Cure Violence or the Institute for Nonviolence Chicago use community outreach workers to help prevent retaliatory violence. Hospital-based violence intervention programs such as at the University of Chicago Medicine and other medical centers throughout Chicago have been shown to reduce recidivism. These efforts are all aimed at secondary prevention, but we must also focus on primary prevention initiatives so that people are not injured in the first place. I know that gun violence feels like an overwhelming problem. I've seen the pain with my own eyes. I've wiped the blood with my own hands. Yet I'm still hopeful because I know that if we take concrete actions and we do the small things that make big changes, we can change the tide of violence that has become way too common and such a devastating problem for so many in our communities and in our nation. Thank you for the opportunity for this testimony.
Thank you, Dr. Rogers. Now, it's a pleasure to recognize Dr. Ronald Stewart for your 5 minutes of testimony, and thank you for being with us and traveling a distance to do so.
Thank you, Chairwoman Eshoo and members of the subcommittee. Thank you for inviting the ACS to participate. It's an honor to follow a hero and colleague of mine, Dr. Selwyn Rogers. I'd also like to thank the leadership and staff of Kennedy King College for their terrific hospitality. The ACS is based out of Chicago, and we are also very grateful for the invitation. For 96 years, the American College of Surgeons has worked to comprehensively improve the care of injured patients in areas such as EMS, trauma centers, disaster response systems, and this has resulted in dramatic improvements in care and outcomes for our patients. For the past 5 years, we've focused much of our efforts on implementing a durable public health approach to reduce firearm violence and to increase the resilience of our country and the health of our patients. The ACS represents those who care for the patients who suffer from firearm injuries. The hardest part of my work is trying to explain to the family of a child, the child who is the very embodiment of the future of that family, a child who was completely normal at breakfast is now dead. For those in this audience who've lost loved ones, Pastor Mitchell, Representative Rush, I know my pain pales in comparison to yours, but I want you to know that we, the American College of Surgeons, are committed to let no one die or suffer in vain. And we know that by working together, we can prevent injury and violence, and we are driven to make this goal a reality. Over the course of the 5 years, we developed our strategy around 3 guiding principles. 1, address firearm violence as a public health and medical problem, not a political problem. This means focusing our attention on serving humanity and basing our actions on scientific truth as best we can determine it. 2, Search for evidence-based violence prevention programs and best practices with the goal of implementing these programs through our network of 554 trauma centers across the U.S. What do we mean by implementing evidence-based violence prevention programs? Is it possible to prevent or cure violence? Well, yes, it is. For those who believe that this is really too difficult a task, to me, it's definitely not more difficult than managing a complex viral epidemic. With the will, it is possible to prevent and cure violence. But to get this right requires the full commitment of all medicine, along with partnerships at the local, state, and federal levels. The people who are right now here, this community, communities across the United States who are working to make this a goal, a reality, need our full support and our full commitment. 3, foster and provide a forum for a collegial, civil dialogue centered on reducing unnecessary death and suffering related to firearm injury. In a very interesting way, this principle has led us to realize that achieving the goals of the first 2 are not as difficult as we initially thought. I told you the hardest thing about my job. I also know your job is difficult. We, the voters, send you conflicting and mixed messages. But I've learned that the message on firearm violence is not as conflicting and mixed as many would guess, if we can actually talk about the problem. We have been intentionally inclusive in our discussions. I've probably talked to more people in medicine on both sides of the political firearm debate than anyone. I've presented and talked with people from Texas and from California, from Chicago and from Little Rock, Arkansas. We've extensively surveyed ourselves and are surveying medical organizations. We've held town halls. We put together a working group of surgeons who are also serious firearm owners. This group produced a set of recommendations which they call the Chicago Consensus 1. These recommendations are included in my written testimony, and I ask you to carefully review these recommendations to give you a real feel for what we can do when we work together. In February, as Dr. Rogers noted, we hosted a historic medical summit on firearm injury prevention in Chicago. This summit consisted of the largest medical and public health organizations in the United States, 47 leading medical organizations. The group identified many opportunities to collaborate in the areas of research, education, targeted injury prevention initiatives. These 47 all support 9 consensus-based recommendations published this month in the Journal of the American College of Surgeons. Our written testimony includes this entire document, which I ask you to also carefully consider because it provides a comprehensive overview of what we mean by a public health approach. Wrapping up, intentional violence is the most neglected health problem in America. And firearm violence is a public health crisis. But I am optimistic. If we commit to addressing intentional violence in the same way we did with motor vehicle-related injury and death 5 decades ago, we can and we will make dramatic progress. This means working together to, 1, make firearm ownership as safe as reasonably possible for those who own firearms and for those who do not. 2, work together to understand and address the root causes of violence. In summary, this is the core of a public health approach to firearm injury prevention. As I said, I am optimistic. While our country currently appears paralyzed by political polarization, we hope that our recent work of building consensus among a range of diverse stakeholders and then moving to action provide a hopeful guide. We do understand there is no simple solution to complex problems, but we also know if we use the power of partnership, innovation, science, these complex problems are completely manageable and, yes, even curable. We are fully committed to working with you. Thank you very much for the opportunity to present today.
Thank you very much, Dr. Stewart. I think each one of you gives us hope with your testimony. I now have the privilege of recognizing Mr. Kerr, who is here today. We welcome you. He is the Director of Violence Prevention for the City of Chicago. You have 5 minutes for your testimony, sir, and welcome.
Thank you. Good morning, Chairwoman Eshu and members of the committee. So great to see an Illinois delegation here this morning and to be at this great campus, Kennedy King College. I'd like to thank the committee for holding this important hearing on community responses to gun violence. Let me start by introducing myself. My name is Norman Kerr. I'm the new Director of Violence Prevention under Mayor Lightfoot's Office of Public Safety. Since day one, Mayor Lightfoot has been clear that her highest priority and greatest responsibility as mayor is ensuring peace and safety in all of Chicago's neighborhoods. And each and every day since May 20th, the Mayor's Office of Public Safety has been building on our comprehensive reduction strategy with the goal of measurably reducing gun violence. Chicago finds itself in a unique period. In 2016, the city suffered a dramatic increase in shootings and homicides, more severe than that experienced by any of the other 5 largest American cities over the past 25 years. The vast majority of these homicides were committed with illegal guns. Across Chicago, communities have been devastated by the hundreds of homicides and by the thousands of non-fatal shootings that occur each year. In addition to long-lasting trauma, estimates of the direct and indirect economic costs run to billions of dollars per year. Since 2016, the trends have improved. Shootings and homicides have seen double-digit, year-over-year decreases 2 years in a row. In fact, over this past summer, we saw an accelerated decrease in violent crimes, with June, July, and August seeing the lowest number of shooting victims since 2014. And while many organizations are tackling gun violence independently of city leadership, through various privately funded frameworks, the experience of peer cities shows that violence reduction efforts are far more successful through effective coordination of resources, policy, and management decisions across all stakeholders. Mayor Lightfoot's commitment to promoting safe communities and reducing gun violence is evident in her appointment of Deputy Mayor for Public Safety, Susan Lee, who leads the city's first ever Office of Public Safety. As the mayor's point person for all anti-violence efforts, the deputy mayor is responsible for public safety oversight and operations with activities grounded in 3 areas: leading a comprehensive violence reduction strategy by collaborating with street outreach and other community-based anti-violence organizations, while also ensuring coordination with city agencies and the police department, guiding public safety agency operations, including Chicago Police Department, Chicago Fire Department, Office of Emergency Management and Communications, Civilian Office of Police Accountability, and Police Board, managing consent decree reform priorities, leading gun policy strategy, and liaising with state and county governments. And finally, building on data and research critical to policy decisions, including regular analysis and review of violence trends, as well as evaluation of violence reduction initiatives. As core components of its initial efforts, the Mayor's Office has convened bi-weekly regional coordination meetings on the West Side and South Sides, facilitated broad yet targeted collaboration across city agencies through monthly public safety cabinet meetings, and launched the GunStat Initiative, an unprecedented collaborative effort with the U.S. Department of Justice, the Cook County State's Attorney's Office, the Office of Cook County Sheriff, and other major partners that is designed to track gun offenders in order to identify trends and strengths and address any weaknesses within the criminal justice system. We have embarked on a proactive strategy that looks at gun violence as a public health crisis, which is what it is. While we continue to see consistent reductions of violent crime throughout the city, Mayor Lightfoot will be the first to say we have much more work to do. Together, we have to restitch our broken safety net. We have to work on providing wraparound services and job training in the neighborhoods that have been under siege and economically distressed for decades. We recognize the fact that this will not be solved overnight. But by investing in neighborhoods and addressing the root causes of gun violence, we can continue to make meaningful gains in public safety in communities throughout the city. We'll continue working with Chicagoans from every neighborhood and background, from block clubs and faith groups to businesses and school communities, who have joined us hand in hand in our multifaceted, comprehensive approach to reducing violence in our city. Continued improvement for the people of Chicago will also take cooperation by all levels of government. I look forward to working with this committee to further policies and programs that create and maintain safe communities for our families to thrive. Thank you, and I look forward to the continued work.
Thank you, Mr. Kerr, and please give the best of all of the committee members to the mayor. Thank you for being here this morning. The chair now recognizes Mr. Leek for his 5 minutes of testimony. Thank you for being with us.
Thank you, Madam Chairman. Would it be out of order if I give honor to God, my Maker, my Creator, this morning as we approach these most important hearings where
Amen.
where our congressmen who represent us well, who are here today, Congressman Garcia, Congressman Chakowski, and Cook, and Davis, and my brother, Congressman Bobby Rush, who gave us the invitation to come here. I thank you for this privilege, and I want to say to you that I am the CEO of an 85-year-old funeral service organization. That no week goes by, members of Congress, that I don't service the families of at least two gun violence victims. I have to service them and then try to counsel them and try to answer the question that is invariably asked by the mothers and fathers of the children that I service and that question is one word. Why, Mr. Leek? Why? Of all of the families that I've serviced, one comes to mind this morning. Let me share with you. It's on March 12th, 2013. The mother and father of 6-month-old Janika Watkins came to our funeral home seeking our service. The city of Chicago had to lay this precious child to rest. And her death touched my heart, even though I am a professional funeral director. When I think about her short lifespan, a verse of scripture found in the book of Revelation, the 6th chapter and the 13th verse, seems to define her in a profound manner. And the stars of heaven fell unto the earth, even as a fig tree casts her untimely figs when she is shaken by a mighty wind. Truly, this little baby girl was an untimely fig who was not allowed to reach her potential. Her life was cut off by the mighty winds of guns and drugs, causing so much death and destruction to the hearts of the future of our children. Death and destruction caused by black-on-black gun violence. So much evil is manifested in its wake. The challenge to all of us who live in this city as well as this nation is to engage those mighty winds of adversity. We must reverse the tide that has seen too many figs cast out, untimely figs here in Chicago and across our nation. 30 years ago, Madam Chairman, I had the honor to be the director of the Cook County Department of Corrections. Inmates coming into the jail accused of homicides were predominantly black. Their perpetrators were predominantly black, as well as the victims. They were abusing alcohol and drugs during the commission of the crime. And finally, the perpetrators and the victims were known to one another. There was a relationship. And because of that relationship, the police were able to arrest the perpetrator in the majority of the instances. Today, Madam Chairman, those circumstances are reversed. In the majority of homicides, the perpetrator has no relationship to the victim. These homicides are mostly random violence and so often renders the police and the courts the challenge in seeking an arrest. The role, I believe, of Congress must be one that recognizes that unless in an earlier period of the life of the would-be perpetrator, they must receive some type of special crime prevention. It is not found, as it could be, in the home, in the church, but it is found in my examination in the schools. The perpetrator and the future victims were students at one time in the Chicago public schools. If we can create an environment that in those particular schools that teaches morals, character, good citizenship during their formative years, we'll be able to save hundreds, even thousands of lives. My brothers and sisters, you who are congressmen, we are depending on you today to leave Chicago knowing that you're going to do something about what plagues us as a city. God bless you.
Thank you, Mr. Leak. You have summoned us to a higher place, for sure. I now would like to recognize, last but not least, Dr. Neva Lubin-Johnson, the immediate past president of the National Medical Association, and welcome to you, and thank you for being here. You have 5 minutes for your testimony.
Thank you, and thank you, Congressman Issue, for the invitation this morning. To all of the Health Subcommittee members for holding this hearing today here in my hometown of Chicago. I would especially like to thank Subcommittee member Congressman Bobby Rush, who is my congressman, as well as Congresswoman Robin Kelly, who I have had the pleasure with working with quite frequently on a myriad of health issues dating back to when she was a state representative. And the other Chicago congressman here today, my colleague in healthcare, the Honorable Danny K. Davis, and to Jesus Garcia and Jan Schakowsky, also fellow natives of Chicago. I'm here today to talk about policies and solutions to the public health threat posed by gun violence, not only as a physician who has practiced internal medicine for over 30 years here in Chicago, but also as the immediate past president of the National Medical Association. NMA is the largest and oldest national organization representing African American professionals, doing so for over 50,000 African American physicians and our patients in the United States and its territories. We are the collective voice of African American physicians and the collective voice and the leading force for parity and justice in medicine. Gun violence has been a key issue for NMA and continues to be on the forefront this year as it was throughout my presidency. As you know, it's one of the leading causes of death in America, where more than 39,000 people die by guns every year and 85,000 more suffer non-fatal injuries. It costs our economy $229 billion annually, and the cost of firearm assault injury include work loss, medical mental health care, emergency transportation, police criminal justice activities, insurance claims processing, employer costs, and decreased quality of life. We know the statistics about what has gone on here in Chicago, and fortunately, those numbers are decreasing. But also, I want to make note that Chicago per capita is not the highest city of gun violence. I believe we rank about number 15 in the country, definitely not in the top 10. So, what do we do about it? One, as mentioned before, we've got to look at where the guns come from. 60% come from outside of Chicago. And we have to deal with how they get into the city. In November of last year, the National Rifle Association had the audacity to tweet, "Someone should tell self-important anti-gun doctors to stay in their lane." After the American College of Physicians released a report calling this a public health crisis, physicians, including NMA, countered, "This is our lane." And as you heard, more than 40 medical organizations, including NMA, joined forces as a coalition to raise money to confront this related death and injury epidemic as a public health initiative. It hit close to home here in Chicago after the tragic shooting of award-winning NMA member Dr. Tamara O'Neill outside of Mercy Hospital. I, too, am on staff at Mercy Hospital and have been so for over 30 years. I didn't know Dr. O'Neill, but I wish I had. As you know, she was a graduate of University of Illinois and worked at Mercy's Hospital. Two physicians I know closely were involved that day. One is a urologist who saved my husband's life. He is a prostate cancer survivor who actually was going across the hall when he heard the shots. And another who I'll tell a little bit of my age. I'm over 50, yes, and I need a colonoscopy. The first man to do that was in a room getting ready to do a procedure on a patient, had to lock himself in the room when that perpetrator knocked on the door where he was. NMA has long been an advocate of stemming gun violence in our communities and the country at large. We are in full agreement with the American College of Physicians that gun violence and violence prevention is a public health crisis, and we believe it demands a multifaceted approach because, as we all know, as Late Carl Bell said, this is a multifaceted problem. There are different types of violence. In 2017, we published a position paper on gun violence. In 2018, we developed a fact sheet on gun violence and advocated for it while on our Capitol Hill Day during March of this year. In July, with 10 other African American professional organizations, we crafted a letter to all of the presidential candidates outlining gun violence as one of our top issues of concern. On August 4th of this year, myself, along with Dr. Stewart and Dr. Roger Mitchell, who's the chair of our task force, appeared on CBS Sunday Morning on a story about gun violence and the public health coalition that has formed as a result of that NRA tweet. We've endorsed the House-passed H.R. 8, and we've also advocated for other pieces of legislation that have been crafted by the House of Representatives. We call on the federal government to immediately convene a bipartisan commission to evaluate steps to reduce and eventually eliminate gun violence utilizing a public health approach. I'd like to include in this research the fact that NMA is now surveying our 4 historically Black medical schools to see where they can come and help in this space, but also to study the effects of lead in terms of violence and aggressiveness, but also to continue the work of Dr. Carl Bell in terms of fetal alcohol syndrome. It's a decrease of choline levels and that leading to increased violence. I want to thank you all for the opportunity to be here this morning on behalf of NMA and our president, Oliver Brooks, and I look forward to your questions. Thank you.
Thank you very much, Dr. Lubin Johnson, and thank you for the support that you just expressed for H.R. 8, the comprehensive background check legislation that is now at the doorstep of the United States Senate, and we pray that that will be taken up because we know the good that can come from that. Now all of our witnesses have testified. I'm going to call on Congresswoman Robin Kelly. I won't start with the questioning. I want to make sure that both Congresswoman Kelly and Congressman Kinzinger get to ask their questions. They both have time limitations today. So I'll set my questions aside for now. Recognize the gentlewoman for her 5 minutes of questioning.
Thank you, Chairwoman Eshoo, and thank all of you for your testimony. It's very much appreciated, and we are listening, believe me. I'm not going to call you Pastor Mitchell. I'm going to call you Brenda because you call me Robin. Thank you so much for testifying today. And as you've heard me say before, thank you for being so selfless because you could go in your home and close your door and not be bothered. But as you chose to be an advocate, you chose to turn your pain into passion. So thank you so much. I'm just going to cut right to the chase. What do you want Congress to do? What do you feel like we can do to be helpful to help families and communities?
No.
I think that what we need to do is to, number one, pass H.R. 8, which I did speaking for the Senate to take seriously what is happening in our communities and the blood that is left on the ground in our communities, to understand that that becomes holy ground for us. It's sacred. And even with the lack of resources around trauma-informed care, it took me to almost have to lose my life 3 times to realize what I was going through. And in addition to that, to be vulnerable enough to remove the stigma of accepting therapy and counseling, to move through all the emotions that I was experiencing that were attacking my internal organs, and to be able to understand what it is to try to come back to yourself, because that's life-changing. I became somebody that even I didn't recognize or know anymore. And I had to find myself, my way back to myself. And so I asked Congress to put forth more research into trauma. And when we talk about trauma, to move it from being a mental health issue, because I don't identify with mental health, but I do identify with being traumatized and having my heart ripped out of my chest and a sore that I know would never be healed.
Thank you. And also, I don't know if anyone in the audience was there, but I just want to publicly thank all the people that got on the bus to come to Washington, D.C. I think that was so very important. And I don't know if everyone knows, but after the rally was over, we took families from Kentucky into Senator McConnell's office to talk to them about please passing both bills that we sent over in February. Dr. Stewart, I wanted to ask you, you stated in your testimony that there's a work group to address the social determinants of health and its impact on violence in vulnerable communities. Can you explain the intersectionality of structural violence and social determinants of health, especially as it relates to gun violence in underserved communities?
Yes, ma'am.
We talked about that.
The chair
I talked
can
about
just,
that in my statement.
Chair can just intervene here. We have, yeah.
Really?
All right. Well, we need to go on. We need to go on with our hearing. Congresswoman Kelly, you have the floor, and
Yes.
you can keep your. Please, sir.
Yes.
We're trying to have a hearing here. All right.
Yes, ma'am. So you may just answer. So if you look at the strategy, if you look at the strategy for the American College of Surgeons, I was clear with respect to that. Make firearm ownership as safe as reasonably.
Order until this.
Why don't we just pause for a few
No.
moments? I think if we can ask, the gentleman to move with the others out of the room so that we can continue with the hearing, please. I think that's very important to understand that this is not a town hall meeting. This is a congressional committee having an official congressional hearing to listen to witnesses that will instruct us in order to address the epidemic of gun violence. Each one of us does town hall meetings in our congressional districts. We are thoroughly accustomed to people shouting out at us and being unrestrained and hearing from them. But that's not what today is. Today is the hearing with the witnesses, professionals, all being instructive to the Congress on how we can shape tangible legislation that's going to have an effect on addressing this epidemic in our country. So I think it's important to delineate the difference between a town hall meeting and a congressional hearing. So now I would ask my colleague, Congresswoman Kelly, to resume her questioning. And thank you, everyone, for your patience.
I just wanted to add to that, we did have members of Congress come to Illinois, and we did meet with the group of course, we can't meet with everybody, but we specifically met with young folks under 25. Most of them were under 20. So we have done things like that also. But Dr. Stewart, do you remember the question?
I do.
Okay.
I do. And so working to understand and address the root cause of violence is one of our two-pronged strategies. And that means we have to get to what many people have testified and what many of you commented on, addressing social determinants of health and structural violence. What do we mean? What does Dr. Rogers mean by structural violence? It's the ways we put individuals in our communities in harm's way. And there are things that's not easy to see. As a fish, we have a colleague, Wayne Meredith, who would say a fish can't see water. And so it may not be obvious to us, but there are structural issues that lead to increased violence and increased rates of death. And so we have put together a work group, which is a national work group of experts in addressing social determinants of health and structural violence. We call that the I SAVE work group. We view that as complementary to our firearm strategy team work group, making firearm ownership as safe as reasonably possible while trying to work to understand and address the root causes of violence. And in violence, too, I'll just say, feel free to interrupt me, but I would say that it's a bigger problem than what we realize. Because it's true that there's 100 to 109, 100 to 110 people who die every day from firearm violence. There's actually 182 who die every day from intentional violence from all mechanisms. So working to understand and address the root causes of violence is critical. And that's just the death. That's just the deaths. It does not take into account the magnitude of the health burden, which is tremendous. And an investment by Congress in this, I believe, is critically needed. And I think it will return benefits far beyond that investment.
Thank you, Dr. Stewart. And finally, I'd like to submit for the record my Kelly report on gun violence in America, which includes common sense policy recommendations to reduce the gun violence epidemic.
So ordered.
I yield back.
The gentlewoman yields back, and now I'd like to call on Congressman Adam Kinzinger for his 5 minutes of questioning, and thank him again for being here and making our hearing very importantly a bipartisan one.
Well, thank you, Madam Chair, and again, thank you for yielding the time. I appreciate it, and to all my colleagues, and Robin, thank you for good questions too, but especially to the witnesses, thank you for being here. Your stories were both emotional and also informing, so thank you for that. Pastor Mitchell, I don't know what to say except my deepest condolences, and I appreciate you sharing your story because I think it's important for all of us to see how it affects family, how family can do their best to overcome, and it brings a human element that sometimes when we talk about statistics, which, we have to talk about statistics, but sometimes that gets missing, and I appreciate you doing the very difficult thing, but bringing a human face to that. And so my deepest condolences and to you. Mr. Leak, I just want to say to you, I don't have any questions, but I wanted to make a point, which is thank you for your testimony as well. Evil is a very real thing. And we don't talk a lot about it, but for whatever reason, there's a generation of young people, and I think it transcends race and it transcends income and boundary lines that are listening to the whispers in their ear and doing really terrible things at very young ages. And I attribute that partially to evil, mental health, and I appreciate you bringing that up. But to the questions, Dr. Rogers, you mentioned in your testimony that the University of Chicago has developed a program that employs people with similar life experiences who help connect trauma patients and families to wraparound services, which include vocational training, mental health counseling, and other social services. Can you elaborate further on how this kind of hospital-based intervention And outreach to high-risk individuals presents unique teachable moments, basically improves outcomes and prevents future violent injuries.
There's a network of hospital-based violence intervention programs across the country. Approximately 30 hospitals have invested in these programs. And they basically take people who have been injured by violent injuries, be it gun violence, stabbings, or assault, and use that moment to intervene in their lives. Basically think of violence as a chronic disease instead of an acute event. And in the context of that, people often come in with pre-existing social issues that they need, educational disparities, economic opportunities they have not taken advantage of. And being able to invest in people through these hospital-based violence intervention programs have found significant effects in decreasing recidivism rates of recurrent injury or retaliatory violence. The other aspect is preventing people from injuring someone else. There's a common saying that hurt people hurt people. And when we think about the opportunity that hospitals, health systems may have to intervene in people's lives who have been hurt to prevent retaliatory violence, it's a very important possible intervention.
And I want to add to that. So a lot of people don't know this about me, but my father was a director of an organization that helped the homeless. And one of the things that they really took as a way to do that is to understand that homelessness was not just the fact that you don't have a shelter over your head at night. There's a lot of other things that lead to that. And how do you wrap that around? And I think the same thing comes when it comes to violence. If somebody comes into a hospital with a gunshot wound, obviously your priority is to heal that person and ensure they continue to live. But if they're just pushed out the door or they're not given any other opportunity, you will likely see that person back in the same position. So it's how do we interdict that? And I appreciate you bringing that up. Dr. Stewart, you were the lead author of a study published, which you discussed, that identifies some common ground solutions to reduce violent harm. Number 5 in the consensus statement raises the importance of engaging both firearm owners and populations at risk. Can you elaborate further on the need to engage the community of firearm owners and why as part of that solution?
I can, and I do think it's a critical piece of the public health approach, which is to engage people who are at risk and a part of a knowledgeable stakeholder group. I'll just give an example. If we were going to do a bicycle safety initiative in a neighborhood, we would come with data, we would come with expertise, we would have all that. But one of the things that we would do right away is we would engage with the bicycle riders. We would engage with them for their expertise, for their knowledge, and for their buy-in. And we've done that in the past. And we know that we learned from bicycle safety initiatives. We learned that bicycle helmets were not cool. They're not thermally cool, and they weren't culturally cool. And so we made bicycle helmets thermally cooler and culturally cooler, and you see people wearing bicycle helmets.
Yeah, that's always been a surprise to me. I was raised in the generation where you never wore bicycle helmets. But I will tell you, we've got a lot of questions. Thank you all for being here. My time's up, and Madam Chair, I yield back.
The gentleman yields back, and I know both of the members that just questioned have other commitments and need to leave. The committee, the witnesses, and everyone that's here today, thank both of you, both for your leadership and your ongoing work and your attendance today. And you may have noticed that we were leaning over and kind of whispering to each other. It's part of our team building because you're giving us ideas. So travel safely, make your meetings, and thank you for being here today. Let's applaud them. Let's applaud them. All right, the chair now recognizes herself for 5 minutes to ask questions. Is there anyone on the panel that does not agree that that gun violence is an epidemic and that we work through the public health lens to address it? Is there agreement across the panel on that? I think I heard all of you. Yes. I see everyone nodding. Because that's what this hearing is addressing itself to. In the work of the Congress, if you were to advise us on shaping legislation, what would the top 3 or top 5 initiatives be that you would recommend to us? I think at the top of the list is that we need to first secure the kind of data that can be shared when there's an epidemic. Certainly the CDC and the NIH develop the information so we can work off of facts. It's very important, especially in the scientific community, that we have facts. And we've already, as I said in my opening statement, Congress has appropriated $50 million. If you divide that by 50 states, it's not a lot of money. But it's a start, and we have to start somewhere, and we can build on that. But aside from that, what would you recommend to us that we take back to DC with us and build into legislation to address this epidemic in the public health lane? Whomever would like to go first.
Sure, I will go first. So with an epidemic, you have to go to the population that's most infected. And in this case, you have to go to the population that's violent. And there's no way around it. You have to develop that relationship with them and change their trajectory. So if you're going to vaccinate them, if you will, and provide opportunities and guidance and support so that vaccination will take and they'll be on a different trajectory. Now, I'm not opposed to prevention programs. I think it all has to be in concert. It's not a competition between intervention and prevention. But we have to look at where the data says, okay, this is the group that is most violent. And if we don't develop a relationship with them, that change is going to be minimal. So this is something that we have to invest in. Just even this thought is that this population is not a throwaway population, that they can change. And we've seen this. We've worked with individuals who have been on a certain path, and the intervention is with them, and then they change what they're doing. Now they're actually working for the program and helping others to make that change as well. But it has to be something that's really thought out. And also, we have to look at their ecosystems. So it's not just working with that individual, but what does their home life look like? What does the people who are in their networks, social networks, family networks, look like? What are they going through? Because they impact that individual.
Thank you. The doctors, I think, want to lean in on this.
I'll lean in and add what Mr. Kerr said. There has to be a lot of investment to reverse the chronic disinvestment in communities, especially communities of color that have been disproportionately affected by violence. Way too often, violence can be intergenerational. I meet with families every day who say that not just their cousin, not just their father, not just their brother has been impacted by gun violence, but multiple people in their families over generations have been impacted. And without really thinking about what the psychological, emotional toll that takes upon families and how that leads to secondary trauma in people, we will not be able to make a lasting impact. And in many ways, because this is so long-standing, we're going to have to make a very deep, concentrated effort to make an impact. And I think if I could make any recommendation to Congress, it's not going to be a simple Band-Aid solution. This is going to take years of commitment over time to reverse what's been present for decades.
Well, in listening to Pastor Mitchell talk about all that she went through physically and the depression that surrounded her and deepened her grief even more, that we do a lot through the Department of Defense relative and the Veterans Administration relative to PTSD. It seems to me that that you're a witness and someone that has experienced that, and I think it needs to be a part of what we do. Did you
Yes,
want to
I
add to
think
that?
I was on a town hall with Senator Chris Murphy and Congresswoman Lucy McBath, and the question was asked, what was the one thing that we're not speaking about or addressing in terms of the gun violence initiatives? And the laws, we know how important that is, and although they have not made it to the Senate floor for reality to be our experience, we realize that there's devastation in our communities, and those things have not been addressed. And as Dr. Rogers has stated, it's not anything that has happened overnight, but I believe that with the research that has to happen in our communities, there also has to be dollars that deal with the socioeconomic issues in the communities as well as the devastations, and to have more resources out there. I had the luxury of having insurance. I had the luxury of being able to talk through my issues. Everybody doesn't have that luxury.
Right.
And unfortunately, it's not even available in most cases because we're not even creating the narrative around trauma and trauma-informed care until most recently. But there still needs to be more work and support driven in those avenues.
Thank you very much. My time has expired. I now would like to recognize the gentleman, and a gentleman he is, Mr. Butterfield from North Carolina.
North Carolina. Thank you so much, Madam Chair. Let me just begin by reiterating what Chairwoman Eshoo said a few minutes ago. This is not a town hall meeting. All of us have our own individual town hall meetings from time to time. This is a congressional hearing. Why do I make this point? I make the point to say that this is not a political exercise that we are conducting today. This is serious business. The Congress of the United States spends billions of dollars every year in non-defense discretionary spending. And if we are to invest in this issue and invest in methods of gun prevention and the other issues that we care about, including education, we've got to build a congressional record, and that's what this is all about today. We are building a congressional record. We will take this information, and a verbatim copy of what is being said here today is being placed in a congressional record. We will take this information back to our committee. Our committee will then have further hearings. We will mark up legislation, and at some point it will be presented to the entire House of Representatives for a vote. And so I just wanted to go on record to making that known for those who may not fully understand the scope of what we're doing today. The statistics show, Madam Chair, that 39,000 firearm-related fatalities occurred in 2017. 39,000. 83 children injured or killed by guns each day. Inaction is not an option. Even more disturbing is the way in which we fail to treat this as a public health issue. We have not invested federal dollars in public health research to better understand how to prevent firearm-related injuries and death. We have invested in criminal justice initiatives, but we have not invested significantly in public health research. We were able, a few weeks ago, to approve appropriations in legislation in the House to provide $50 million to support this research, and that is just the beginning. So let me ask our witnesses, and thank you to all 6 of the witnesses, but let me ask our medical experts, if I can you share how you think this investment could help us better understand and address this crisis and the impacts it has on your patients and your friends? Let's start with Dr. Rogers.
Every day I'm struck by the fact that gun violence has devastating effects, not just in those who are killed, but those who are left behind. And I think those people who are left behind, we often don't provide much in the way of any services. And echoing your comments, Mr. Butterfield, we have to invest in research to better understand what works and what doesn't work. Even for returning veterans, post-traumatic stress disorder is a very difficult problem to fix. And as Ms. Mitchell noted, Pastor Mitchell noted, it has long-ranging effects for decades after the traumatic event. And we have to find ways and approaches to address this in a more lasting way. Only through research can we do that. We've found incredible ways of addressing the AIDS epidemic, for example. So AIDS is now a chronic illness that people can live for decades with HIV. we have to find ways of intervening in people's lives to prevent violence and find solutions to problems that the greater society are often ignored. And I think if that focus can happen through this congressional hearing, that may be an important
Thank
start.
you. In the last minute that I have remaining, Dr. Stewart and then Dr. Lubin Johnson, please.
I would say the impact on our patients would be that they would be, if we invest in these things we've talked about, they would be healthier, they would be more resilient, they would be stronger, and they would be more free. And it is critical that we make this investment and we do it across the entire spectrum of violence.
Thank you. Dr. Lubin
Yes.
Johnson.
Yes, and thank you for that question, Congressman Butterfield. I believe, the investment is important for our patients, our communities, especially their families who are remaining, whether they've been, their loved ones have been injured or killed. I've took care of 2 patients that come up to note. One, her daughter was killed going to the grocery store and left a 5-year-old son behind, who she cared for during the week. And the father, they had a great relationship. He took care of the child during the weekends. She ended up obtaining care through her job, through employee assistance programs, but I think other programs need to be available to those who are left behind after these tragedies. But also, we need programs to help those who remain in the families, because we know part of structural violence is also there's some elements of structural racism, and we have to do something to level the playing field in terms of the economics, the education, and the health care that these victims and their families have to receive and go through also. Thank you.
Thank you. My time has expired. Thank you for your response. I yield back.
The gentleman yields back. It's a pleasure to recognize Mr. Rush, whose district we are in today, for his 5 minutes of testimony. Of questioning.
Thank you, Madam Chair. Madam Chair, I certainly want to associate my remarks with my friend, Mr. Butterfield. I want to just reiterate the fact that this is not the kind of hearing where we're going to have a lot of rah-rah and a lot of the applause meter is going to go up. It wasn't intended for that purpose. This is a sober and somber gathering of witnesses and members of Congress so that we can do the work that we were elected to do, and that is to try to provide federal resources to solve the problems that we're discussing today, and that is the epidemic of gun violence, and eliminate or ameliorate the tragedies and the suffering and the pain of families and communities and nations that are affected by this ceaseless epidemic of gun violence. And with that, I want to ask my friend, Mr. Leak, who I've known for many years, and he has criminalized so many families, and including my family. Mr. Leak, has there been a significant and striking demographic change that you recognize among criminalizing families during this particular era of epidemic gun violence? Do you see a significant change in the demographics of gun violence victims that you have to criminalize twice a week? Use the mic, please.
What I've seen, Congressman Rush, is that the perpetrator and the victim, as I said, were African American. And what I've seen is that there is not today the relationship between perpetrator and victim that resulted in a successful arrest and adjudication of the particular perpetrator. And the reason that we're not seeing that as we did 30, 40 years ago, the fact that there's no relationship between the perpetrator and the the victim. Random violence is what we are seeing now. Violence, as we talked about this 6-month-old baby, that baby was not targeted. It was just random violence that plagues us.
Right.
And I'd say there's only one solution to that. And
Right. Mr. Link, let me just get to the heart of this. You know, I remember in Chicago locally, in the late 70s, there was a young man on the near north side by the name of Dantrell Davis. And he was shot down on the grounds at Cabrini Green. I think he might have been on his way to school that morning. And he was shot down. And since that time, there have been more and more younger people who were killed. And when Dantrell Davis was killed, there was a general alarm because he was a young man, 9 years old, who was murdered. But now the incidences of young people being killed has increased. And I'm saying, do you agree that unlike as we were becoming adults, most funerals was for older family members who had died mostly of natural causes? But today, is it the same today, or has there been a subtle and significant switch that most funerals now are not folk who die of natural causes, but young people who die of gun violence or some other type of violent behavior? Do you see that?
yes, I do see that. Congresswoman, I should not have to be servicing a family of a 6-month-old girl. I should be servicing families where the deceased person is my age. I should not be servicing families who have lost their loved ones through homicide, suicide, drug overdoses. I am seeing more of that now than I had in the past. And I just say to you, I must reiterate, and I ask that the Congress, you have an effect upon the schools of our city. Federal dollars come from Washington to our city, and all due respect to my friend who represents the mayor, I'm saying to you that take back to Washington this story. 2 young kids were acting up. They were sent to the principal's office. The principal asked them to come in one by one. The first one came in, the principal asked him, he says, Johnny, where is God in your life? And go in and ask Jimmy to come in here. Johnny went out to Jimmy and he said, Jimmy, we're in big trouble. God is missing, and the principal thinks we have something to do with it. God is missing from our schools, and we have a lot to do with it. And I'm asking you, when you go back to Washington, D.C., send some money here, and most of all, put God back into our schools.
Thank you. Dr. Rogers, I want to ask you, you made a statement in your, you made a declaration in your statement. I want to quote you. This violence is a public health issue as a disease, and it means it can be treated and it can be cured. Can you expound upon treatment and the cure for it? What can we do as members of Congress to provide federal resources, more dollars to cure this epidemic?
I'll start by saying there's so much about gun violence that we don't understand. We have made tremendous progress on the ability to do surgical procedures and medical interventions to fix physical parts of human beings, be it broken bones or put back together damaged organs. But we haven't really done much to figure out how to help people's souls and minds. And investing more in the mental health impact of violence, both on people who have been directly impacted by violence physically, but also those who are in close contact. Because there's secondary trauma to everyone who's in close contact with that individual who's been shot and or killed. And to think about ways that we can actually create greater mental health support for individuals who've been victimized by violence, but also their close contacts.
I want to ask, Madam Chair, if I could, Dr. Stewart. Dr. Stewart, you stated, I yield back the balance of my time that's already run out.
I thank the gentleman, and I understand you're being driven to ask more questions because you care so much about this issue. But now I'd like to start recognizing our colleagues that are here as guests of the committee today, all members of Congress, all from the great state of Illinois. And I want to recognize first my friend and colleague, Congresswoman Jan Schakowsky. She has, for many years, she served on our health subcommittee. In this Congress, she's chairing another one. But she turns up religiously to our subcommittee hearings and has to wait for everyone else to ask their questions, and then it's her turn. And it's the same today. But she's here, she cares enormously, and it's a pleasure to recognize her and welcome her once again to the committee and its work.
Thank you. I want to thank you, Chairman Eshoo. It's really a privilege to be able to wave on to the Health Subcommittee, and so I don't mind waiting. I thank you for the opportunity. I want to ask a question of everyone here today. How many of you have lost a loved one due to gun violence that are here in this room? I want to see. Raise your hand so I can see that. So it's affected a good chunk of this room for the panel to know, on the panel and people behind you, and including, we've talked about Bobby Rush, but also I was at the funeral for Danny Davis's grandson. So two issues I want to talk about. I want to talk more about the issue of trauma-informed care, which you raised, Pastor Mitchell, but also the intersection with race, which is really, in many ways, I think, an elephant in this room and on this issue. We know that Black children and teens are 14 times more likely than white children and teens to die because of gun violence, and that Black men make up 52% of all gun homicide victims. So when you were talking about how it's people around those that have been killed, I think we're talking about whole communities where Black children in particular, but children of color, let me put it that way, Black and brown children are traumatized just from the time they're aware in this world of the dangers of their communities. So racial disparities. We know, for example, that women of color in Illinois are six times more likely to die related to childbirth than white women. So these disparities in healthcare are a real challenge. So I wanted to ask Dr. Lubin Johnson, Dr. Rogers, anyone who really wants to answer this, to share what has been successful in dealing with trauma-informed and culturally competent care as we look at solutions to these problems. Did you want to start, Doctor, on the end?
Thank you for the question, Congressman Schakowsky. And I'm not a trauma surgeon, so I'll leave that to Dr. Rogers. But in terms of the culturally informed, competent care, I think we really need to start with what I alluded to before, which is the structural racism in in our country, that's affecting our communities, the health care that's received, where those residents live, the education they receive, the housing that they live in, and understand and recognize that there's a disparity there that leads further due to the socioeconomic differences between our communities and others that really serves as a nadir, let's say, for violence to occur. And so, I have become someone who is a proponent of implicit bias training, and to start with, in terms of helping to eliminate some of the bias and discrimination in our country. And so what is implicit bias? It is bias that we're not conscious of, but gets exhibited in various ways. And we're discovering, as you mentioned, with the issue with maternal mortality in African Americans, that this plays a basis in it. I mean, if Serena Williams can't get the health care she needs, postpartum, who can? And because of that, we have developed now, most states have a maternal mortality review board. And maybe we need a violence fatality review board in our municipalities that take a look at the systems that interface with at-risk youth and who are victims of the perpetrators of violence, and that will work. And there are programs that do work.
I'm going to, sorry, no problem. I do want to ask anyone, Dr. Rogers.
Addressing the,
Yep.
addressing the point about trauma-informed care basically involves meeting people where they are, not where you want them to be. Oftentimes, when we face people who have been the victims of violence, we don't think about the lived experiences that those people have had and how that impacts how they relate to the trauma that they're experiencing. Oftentimes, the trauma is not just an event that happened today, something that happened a week ago, a year ago, a decade ago, a generation ago. And we often do not find ways to incorporate that into care that we provide for that individual patient.
Let me, I'm sorry, let me just let Pastor Mitchell finish.
I think the other thing, when you talk about the trauma-informed care, is to really identify that there is a need for that in our communities, because in the communities of color, we don't identify with mental health or trauma care. There's always the stigma of being treated or seeking counseling and therapy. As a pastor, it's very difficult to say, because in the congregations we believe that if God and I can't fix it, then it's not meant to be done. But to actually, as I stated before, to allow yourself to be vulnerable enough to understand that God has said in that day knowledge would increase, and to be able to accept the knowledge that is before us, and to move ourselves toward wholeness.
Okay. I just want to say one more sentence. While I agree with all of you that it's going to take time, I also want to, the T-shirts are Moms Demand Action. And I think whether it's going to take long or short, what people want to see now is steps, concrete steps that represent action that's going to address this problem of gun violence in our communities. Thank you. I yield back.
The gentlewoman yields back, and now I'd like to recognize the gentlewoman from New York, Congresswoman Yvette Clarke. And thank you for traveling from New York to be with us here today. You have 5 minutes for your questioning.
Very well. Thank you so much, Madam Chairwoman. Let me thank you for doing this field hearing. Let me thank my colleagues of the Illinois delegation for welcoming a East Coast sister from Brooklyn for this hearing. And let me thank our expert witnesses who have come to testify before us today. Dr. Rogers, in the colloquialism of a New Yorker, it's a lot of levels to this thing. And I think that's one of the things that you have mentioned in and repeatedly through your testimony here today. Reverend Brenda Mitchell, I want you to know that we are on the same wavelength. I'm going to give you 3 names: James E. Davis, Gabrielle Giffords, Stephen Scalise. Each of these are colleagues of mine. One is in the past tense. His name is James E. Davis. He was a colleague who was gunned down before me in the New York City Council. I work with that trauma every day, every single day. And as you spoke of your experience, my experience is sitting here bubbling up. There is a lot of walking wounded. And there are many levels to this. It's proximity to what happened, relation to the individuals involved, community. And we have not really wrapped our arms around the extent to which Americans are being subjected to the pain of violence in our communities, in our nation overall. Because for many, it may not even be someone who's immediate in their families. It may be a colleague. I've had 2 colleagues now in Congress gunned down. Thank God they were able to survive. But and we still haven't acted. 1 Republican, 1 Democrat. All of us walking around knowing that our colleagues were gunned down before us. So my question is, and I'm going to open this to the panel, a comprehensive approach from a health and well-being standpoint. How does gun access and availability through trafficking create a dynamic for those who are looking to commit violence? And then what are the socioeconomic indicators that we need to look at in terms of education and the opportunity gaps that help to fortify us against future actions? So it's a multi-pronged approach, but I'd like to just sort of get your take on it, because I think that we're only scratching the surface of the many levels that we have to address through legislation and through behavior modification.
I'm going to yield to the experts in just a second, but I think that I'm also on the school board in my community. And so I get to see the disparity in terms of the education system and what children are presenting themselves with when coming into the classroom. I also get to see the socioeconomics and the institutional racism that kind of denies access to individuals. And so unless we take care of all of the different layers, because it's not a one-size-fits-all, there is trauma, there is gun violence, there's a lack of action for the Senate to move on things like the firearms and the red flag laws. And so all of those things, while they're not being taken care of, it's still our reality. And until, as Dr. Rogers said, we deal with the different levels of gun violence and the byproducts of gun violence, then we're doing a disservice to the public.
We only got a couple minutes. Does anyone else want to address that issue?
So I'd like to add something to that issue in terms of the intersectionality of what occurs with victims of, violence and the socioeconomic status. One thing is, we talk about adverse childhood experiences, and this is one of those, but also others are, housing and access to food, et cetera. All these things are interrelated. I mean, we know that even those stressful childhood experiences of violence can carry over into adulthood with increased rates of heart disease, diabetes, high blood pressure, et cetera. And I think we have to develop programs that take all of that into account. Even, the increased stress of a mother could lead to increased preterm births, as she is pregnant. And so I think we really have to look at how all these things, in terms of average childhood experiences, social determinants of health, how they all play a part in any program that's crafted to help
Dr. Rogers,
decrease
I
the
did
rates.
invoke your name. I did want to get your response very quickly.
Thank you. I do think, as you said, Ms. Clark, it's multi-level, and I think it's not going to be any one simple solution to this problem, but we have to be willing to tackle it on multi-levels. I think I was going to make the comment earlier that race matters. I think if gun violence, intentional gun violence, was disproportionately affecting only white people, it would be a different impetus for making some impact. But similarly, if you look at the issue across the United States, we don't talk about the impact of suicide, gun suicide, on people's lives. That's a silent burden that families bear, and we need to be more open about the impact that that has throughout the country.
Madam Chair, thank
The gentlewoman yields back. It's now an honor to recognize our colleague, Congressman Danny Davis. I said earlier, the voice of God, and the sorrow of the tragedy of losing a family member. That burden is being carried by the congressman and his family when they buried their grandson. So this is it's very important to us that he's here with us today, and that he will work to be part of the solution. Learning from the witnesses, you have your 5 minutes to question my friend.
Thank you very much, Chairman Eshoo. And I really want to thank you for bringing this hearing to Chicago. Far away as New York might be, California is even much further. And I want to thank Congressman Rush for requesting, and the entire committee for acceding to that request. I am so pleased that so many members of the Committee on Energy and Commerce are here participating. We often have these kind of discussions throughout the country, but oftentimes we don't have as many individuals who come from their districts to participate because there are things going on where they are. And so, Madam Chairman, this is an absolute great day for us. I want to thank all of the expert witnesses who have come. And as I have listened, I thought of the fact that less than 2 months ago, 2 young individuals were tried, convicted, and sentenced to prison for the murder of my grandson, 15 years old. Their families are traumatized as much as our family. And my son was amazed when at one of the eulogies I said, you know, I am hurting for the families of the individuals who shot Devon. And he asked me, he says, Daddy, did you mean what you said? I said, yeah, I really did. Because just as there are going to be empty spaces at our Thanksgiving dinner table, there are going to be empty spaces at their Thanksgiving dinner table. And he said, well, the only thing I can say is I think you're a better man than I am. But that's one of the reasons that I am so pleased to have introduced with Senator Durbin a trauma-informed care bill that hopefully will move us in the direction of providing greater access to individuals who have experienced traumatic events. As we've heard, all of us, one way or the other, either collectively or individually, are having these experiences. And so, yes, we need resources. But when I think of public health, my mother taught us that prevention was worth much more than cure. She'd say an ounce of prevention is worth more than a pound of cure. And so we know that there are things that we need to do in order to reduce the presence of gun. For example, I'm big on mental health, trying to recognize its impact. But you know, if a person is feeling a certain kind of anxiety and all they've got is a toothpick, they cannot kill 10 or 12 people in 30 seconds or less. So we must find a way to reduce the presence of guns in our society. We must find a way. We must find a way to eliminate access to these automatic and semi-automatic weapons that shouldn't be in the hands of anyone except military and perhaps in some instances law enforcement. We know what to do, but we must have the will to do it. Had there not been a gun presence in the little conversation that my grandson and his friends were having, he'd be alive today. And they would not be traumatized and facing prison. And so recognizing what to do and then doing it. My question is, and my comment, gun violence is a crisis, but so is poverty a health crisis. So is economic oppression. I understand the young man over here who was talking about jobs, and he has come to believe that of all the issues, because when we talk about the stats and the group that has the most homicides, half of those individuals are out of work, don't have a job, don't go to school, are not engaged in any kind of training program. So this also contributes to their utilization of other forces to do what they do. So, Spencer, my question, Mr. Leak, and I've attended many of those services that you provided, and we see each other pretty much on a regular basis almost every weekend. There is one. How do we comprehensively face the issue that we have and try and make sure that we can seriously reduce gun violence and provide the help that individuals need to have once they have experienced?
Thank you, Congressman. Let me say that I have found that if we can change the mindset of the individuals of these groups that we are talking about. When I was director of the jail, I was telling Dr. Lubin that 15% of the inmate population were there because of mental health issues. And what can the jail do about mental health other than to contain? But I submit that we have not brought into play the correctional systems, federal and state and county of our nation. When I was the director of the jail, I did not, Congressman Davis, think that my job was to contain inmates or to confine them. My job was to correct them. And what I tried to do in that jail is to correct the individuals who come to us. They have no else, they are confined, and therefore they are individuals that we may change their life set. So that's one area there. But I cannot reiterate to you and all of the congressmen here that when I sit down with those mothers, Congressman, of those children killed in violence, I can't come up with anything comprehensive. I can't be really profound. I can only put my hand around that mother and say to her, let's have prayer. And the only thing that will get us through this crisis in gun violence and violence in general is there must be a faith-based solution. And I know that there are those who say it's unconstitutional. We should separate church and state. But I say to you, we've got to change the mindset. And the only one who can change the mindset is the one who changes not.
Thank you again, Chairman Eshoo. I really do, from a personal vantage point, thank you, Congressman Rush, and the entire subcommittee for bringing this tremendous hearing to Chicago. And I yield back.
The gentleman yields back, and you should know that we all hold you in the center of our hearts, and we think you're very, very special. I would just like to say to Mr. Leek that when you see a picture of the floor of the House of Representatives and the Speaker's chair, what is engraved over it are the following words: "In God we trust." I now would like to recognize, last but not least, certainly, our colleague, Chuy Garcia from the Chicago area, and thank you for joining us today and for your patience. You now have 5 minutes to question.
Thank you, Madam Chair, and to all the members of the committee, and of course, all the panelists. As all of you are keenly aware, gun violence is ravaging our communities. It's sad to think how normalized gun violence has become in our city and across the country, and it's time for the government to quit cowering to the NRA and to do something about it. I'm sick of seeing headlines of shooting after shooting occurring all over our country. This week marked a 2-year anniversary since my wife was coming home from going to visit a friend and parking her car in the garage and heard 4 gunshots. She ran to the front of the house to check to see what had happened. A 26-year-old was shot while standing over his bike. She called me to hurry home because this had happened. This is just one more testimonial to others that members have shared, that none of us are immune to gun violence in our country today. Mass shootings have captured the national attention, but are in fact a small share of gun violence in our country. And Chicago's no stranger to the gun violence. It is constantly demonized by the president. It's a popular talking point for those who claim that gun control doesn't work. But there's a big difference between the factors that create the conditions for shootings and our city and mass shootings other places. Our Black and Latino communities have been harmed for generations by disinvestment, racism, poverty, and gang violence. I want to ask Dr. Rogers, why is it important that research properly identifies the root causes of gun violence and distinguishes mass shootings from the types of gun violence we witness in Chicago?
Thank you, Congressman Garcia. As noted, mass shootings represent less than 1% of total shootings in the United States, but disproportionately gets all of the media attention. And in fact, daily, people die from gun violence and suicides by guns without getting the same attention. It's only through dedicated research will we understand exactly what works, be it safer guns, be it hand-imprinted ways of protecting who actually fires a handgun, for example, or actually thinking more holistically, what are the primary and secondary prevention efforts that we can do to prevent people from being injured by firearms in the United States.
And very briefly, how do we get stakeholders, including the media, law enforcement, to properly and responsibly report and highlight these differences?
I think one of the things that is happening today, the ability to try to listen in a way that actually respects people's different viewpoints, I think that is an important starting point for dialogue.
Very well. So recently, our country witnessed the deadliest racially motivated attack targeting Latinos in modern American history in El Paso. But this is not an isolated incident. In fact, nationally, from 2016 to 2017, there was a 24% increase in hate crimes against Latinos fueled by white supremacy and hateful rhetoric coming from the White House. I visited El Paso in the wake of the shooting, and as our community mourned, we also understood that the president is not contributing to preventing these incidents. He's contributing to encouraging this type of violence. I want to ask Dr. Kerr as my final question. Mr. Kerr, what types of resources and community engagement will the city and the relatively new administration commit to providing communities most afflicted by gun violence in Chicago? And I ask that understanding that this is a national panel, but we're also looking at what cities are doing in response to the gun epidemic.
Sure. So, as I mentioned earlier, Mayor Lightfoot's investment in violence, this is something that is a big issue for her, and we are poised to work with other organizations and entities because this is an all hands-on-deck approach that's needed to address this issue. So we are doing inventory of our programming, to making sure that we have ample prevention programs, but also thinking in a comprehensive way. We need prevention and we need intervention. And we need that comprehensive approach to also go along partners. So who needs to be at the table? So of course, city, county, state, federal, but also including our local partners in the process. So we've been able to have different town hall meetings over the last few months to engage organizations, to engage residents, to be on board, to give their input, to contribute to the strategy, because we know it's important to have them available on the ground.
Thank you, Madam Chair. I think my time has run out.
The gentleman yields back. I think that this now concludes the time of questioning on the part of members. On behalf of every member of the subcommittee, we want to thank each one of you, the witnesses. Chicago is known as the Windy City, but I think here today you've really put some wind at our back to address this issue that we are grappling with, that has caused so much grief, not only here in this community, but in communities across our country. The damage to people's lives, the loss of life, but what we can do about this relative to public health and the epidemic that it really represents. So each one of us are extraordinarily grateful to you. What you have given to us is foundational for us to build legislation on. And I believe that we have a lot to work with because you've given us examples of what's happening at the medical center here, what's happening at the medical center in Texas. That can be highly instructive to us, that we have wraparound services, Pastor Mitchell, for what you referenced, and other witnesses. This is a rich record that you have provided for us. We're very grateful to you for it. I want to remind members that pursuant to committee rules, each member has 10 business days to submit additional questions to the witnesses. We hope that you will respond in a timely manner, because that part of the record is very important to us as well. that all of it be captured, and I trust that you will do that. I now would like to ask unanimous consent to enter into the record the letter of support from the Association of American Medical Colleges. We thank the association for that, and hearing no objections, so ordered. Isn't that nice that I can say that? Hearing no, just like that, it's like my little magic wand. Again, to everyone that's here in the audience, there are advocates here that give so much of their time to push and to push, to push and to push. Your time is not wasted. You have formed a national core of patriots to address gun violence in our country, and we are so deeply grateful to you. To those who have suffered the losses in your family, I said in the beginning that your grief more than fuels the effort that we're taking on. We carry you with us, and we want you to know that. To all the press that is here, I also want to salute and thank the committee staff. It is not an easy thing to do, to take a committee on the road and to get everything set up. So they not only worked in Washington, D.C., but they came here before the members arrived to get everything organized. And I think that we can show our appreciation by applauding and thanking them. Thank you. Thank you to everyone. And with that, at this time, the subcommittee, yes.
I also want to acknowledge the work of my own district staff who work hand in hand with the committee staff to make sure that this was
well, of course,
set
and I know
up.
how closely they worked with the committee staff. Thank you. With that, the subcommittee is now adjourned.